welcome to Healthcare Hoax videos. I'm Janet Cimorelli and I'm here with Dr. Herb Slavin, and we have been conversing about low-dose naltrexone and that it has so many applications, and it's really interesting that the more you talk about it, you say, LDN does what? So if you're someone who may be struggling with the issues associated with fibromyalgia, with Crohn's or IBS, with any autoimmune issue, if you're dealing with some pain that has not been able to be resolved with a prescription or other approaches that you've used, then maybe this discussion you need to know a little bit more about. So many different issues respond to the LDN. Dr. Slavin?
When I work with patients, I don't tell them what to do. I explain what I have in mind. I hope they understand it, and then we're in agreement. John, do you remember Cy Sims?
Yes. Okay.
I used to like what he said. He used to say, our best customer is an educated consumer.
That's true.
If you educate yourself, I don't think, if people really paid attention to how they were being treated with all the drugs they're being given, looking at all the adverse effects of the drugs. And by the way, watch the commercials on TV for drugs. Oh, death might be caused by this drug, but they're smiling and having a wonderful day. You would think twice about taking drugs. I think that's part of the reason you see more and more people looking for alternatives. The drugs are very dangerous, but they get away with it.
The drugs are very dangerous, and many times they don't work, and many times there's another symptom that comes about and you need to take an additional drug for that. So here is an array of different health challenges, situations that arise, and LDN helps to control the progression of those issues. And that's where this whole healthcare hoax comes in. You've been told by those advertisements on television that this drug is going to help you, but then very quickly at the end they tell you about all of the negatives.
I think by law they have to. But let me just give an example so you understand how drugs work in this country. Someone will look historically at native populations and see what herbs they're using, and they'll see, oh, those herbs are very effective, but they can't make any money on using those herbs. So they'll take that herb into the laboratory and change it a little bit. So now they created a completely new substance that they can patent and call their own. And now they'll spend a lot of money to promote something. And that's what happens. And that's been done over and over again with various drugs, finding its origins from nature, but they have to change it so they can patent it. That's why they call it patent medicine. Those are the ones they can make money on. Can't do it with low-dose naltrexone.
So I've mentioned a number of different approaches that respond, or a number of different health challenges that respond to LDN. One of the ones that I haven't talked about, Dr. Slavin, has to do with a global epidemic. I'm not talking about opioid addiction. I'm talking about diabetes. And there's really good information that is available with regard to reducing insulin resistance, which is the developmental stage of moving toward diabetes.
Exactly. So one of the other benefits of low-dose naltrexone, besides helping the body with so many conditions, is its ability to help with weight loss.
Wow.
And as you just alluded to, one of the ways it does that, it reduces insulin resistance. High insulin levels are brought on by eating too many carbohydrates, but they're also associated with what's called metabolic syndrome, high blood pressure, high cholesterol, increased weight. So it helps lower insulin resistance, so your insulin becomes more effective and you avoid the high blood pressure. So one could say it may be effective against high blood pressure and cholesterol as well. increases growth hormone, modulates appetite. In other words, they're trying to match the number of calories you take in based on what your body needs. Now, I remember asking patients, do you eat when you're hungry? And the patients say, no, what's that got to do with it? You know, they eat because it's 12 o'clock, time for lunch, time for dinner, instead of eating when you're hungry. Another important way low-dose naltrexone works is reduces inflammation. It can improve sleep and sleeping patterns and improve thyroid function. I had a patient with an overactive thyroid gland. So I put her on the low-dose naltrexone. Around month 5 of taking it, all of a sudden her thyroid hormone levels went back to normal. Very impressive.
Had they progressed over that 5-month period a little bit, or they stayed the same and
Then we checked it,
boom?
all of a sudden it's just back into the normal range.
Okay, so have you seen that 5-month time frame
Yeah.
in other situations
Yes,
with LDN?
yeah, don't expect it to work, right away. Although some people may find some benefits sooner. You really need to give it, at least 5 months. And I think if you look at some of Dr. Bahari's experiences, he also notices the results in 4 to 5 months when he talks about no longer seeing the tumor grow or seeing the tumor shrink, in the 4 or 5 month range.
Okay, so a patient has their blood work done and they have an elevated SED rate. So that's typically a marker for inflammation. Have you given it to any patients to modify their inflammatory markers?
I have, and I've seen some improvements, but I wouldn't start there. That wouldn't be my first choice. I would want to improve their diet.
Of course.
That's the number one thing you can do. If you have any complaints, you have to improve your diet, because the types of foods we're constantly being exposed to can create lots of side effects, believe it or not.
Okay, so we're talking about LDN, and it kind of sounds like this miracle that's appropriate for so many people to use and for so many different health challenges. But we should keep in mind that their diet, their lifestyle, their sleep habits, those kinds of things are the foundation for having LDN work as optimally as possible.
Well, I'll give you an example. I reserve drugs as a treatment of last resort. In other words, you try to, like you said, fix the diet, get somebody exercising, consider exposure, environmental toxins that they might be exposed to. So you would test for example, those toxins, correct any hormonal imbalances or hormonal deficiencies, check the thyroid function. That's a common problem for a lot of people. So, you fix all those things, the patient isn't getting better. Now you start considering, okay, the immune system isn't working. What's really behind everything, in my opinion, is there's an infectious component. I mean, maybe you have some infections that we all harbor in our bodies that become active and creating those symptoms for you. And you want to enhance the body's ability to deal with those infections. So that's when you start thinking low-dose naltrexone or ultraviolet blood therapy, intravenous vitamin C, all the things that help the body, improve its ability to fight infections.
So you've heard us talk about low-dose naltrexone, and if you want to find out how you personally may benefit with using low-dose naltrexone and you'd like to work with Dr. Herb Slavin, because of his experience and his having delved into the research that's available regarding low-dose naltrexone, you can call in South Florida 954-748-4991. The Institute of Advanced Medicine takes most insurances, and you will be able to get the kind of attention from a functional perspective that maybe you have not necessarily had that attention before. You've been watching Healthcare Hoax videos, and when you go to healthcarehoaxvideos.com, you can get a notification when you subscribe when the next video will be posted. Well, thanks for watching.